In the words of famous 18th century poet, "Ah, well a day what evil looks had I from old and young. Instead of the cross, the albatross about my neck was hung." The albatross in question is the prostate cancer that killed 300,000 men in the year 2020 alone. I'm talking about 300,000 fathers, partners, and friends. So now, what are our options for prostate cancer? A standard treatment of prostate cancer is a surgical procedure called as radical prostatectomy, where cancerous prostate is removed from the body. For simplicity, I'll call it RP. The primary goal of RP is to remove the cancerous prostate that you see in the middle, while a secondary goal is to preserve the surrounding healthy structures. Primarily, we are interested in two structures here. One is responsible for sexual function and another one is responsible for continence function. Preserving these structures is important to maintain a post-operative quality of life of the patient. Therefore, the success of RP depends on this fine trade-off between taking the cancerous prostate out while preserving these attached healthy structures. Nowadays, 80% of these procedures are done using a robot's assistance. In this type of surgery, instead of opening up the entire abdomen, surgeon makes small holes, and then through these small holes, miniaturized camera and surgical instruments are sent in. Then to perform a surgery, a surgeon very comfortably sits on this surgical console that you can see on your left and looks through it at the surgical camera. While looking at the camera, a surgeon controls these instruments very intuitively. This leads to a high precision surgery that can drastically reduce the recovery times. In many cases, they are reduced from months to a week or two. However, despite this technological advancement, some challenges remain. To make you fully understand the challenges, I'll have to show you what a surgeon sees through the camera during surgery. Please be aware, in the next slide, you're going to witness some blood. If you're uncomfortable, please don't look at it. However, to truly understand the problem, I'll urge you to look at it. This is what a surgeon sees. In this 3 centimeter small organ, a surgeon is supposed to estimate the boundaries between the cancerous and non-cancerous regions before making any cut. This is not trivial because these boundaries are not visible in this image. So to know the location of tumor, a surgeon usually refers to a traditional imaging technology such as MRI. In MRI, all these structures are visible. The green is the prostate. Then a surgeon mentally maps this MRI to the camera view. And this mental estimation to estimate the cancerous and non-cancerous regions from each other leads to many cases of incomplete cancer removal. Now imagine the trauma that a patient has to go through after realizing that some of the cancer was left behind after the surgery was performed. And this is what I'm trying to optimize as part of my PhD. We have reimagined a solution along with surgeons at Vancouver General Hospital where we are trying to display these boundaries clearly in the camera view itself. As part of my PhD, we have developed an augmented reality system. On the left, you can see a prostate phantom. The blue is the prostate. And on the right, you can see the same prostate phantom, but with my visualization on it. The MRI plane is the cross-sectional MRI of the prostate. The pink is the mesh generated from the MRI. To see different structures and estimate tumors, a surgeon can control the MRI plane very intuitively using the surgical instrument in real time. Therefore, the decision is well informed. Since MRI is well known among surgeons, this technology is very easy to adapt during surgery. Now, to make you understand my technological contributions, I'll take you behind the scenes. Technically, the goal here is to go from MRI to the camera image because I want to MRI in correct perspective in the camera image. In the past decade, many PhDs in our lab developed methods to go from MRI to the robot. Now, for my PhD, I want to find the missing link from the robot to the camera image. I estimated that by developing many mathematical and computational methods. And here are the results. On the left, you can see the MRI projected on the camera image without that missing link. It's from the robot to the camera image. And on the right, you can see my corrected transformation applied. The importance of this work has been recognized in the form of 2 academic awards at international venues, one at Munich and one in China. And I'm very happy to share here that the system is almost ready to be tested in real surgeries at Vancouver General Hospital in a few months. In the end, before closing, for anyone who's concerned about patient safety, I always like to give analogy of landing a plane safely. Now imagine here, surgeon is the pilot and our technology is like one of the many features in the cockpit. If the surgeon thinks that our technology will help them to land the plane safely, they will use our technology. Otherwise, they won't use it. What I'm trying to stress here is that the surgeon is the center of this entire decision-making process, with the patient safety being of prime importance. In the end, I would like to say that death and disease are real and inevitable, but my hope is that our technology will at least ease the pain for some. Thanks for listening.